If I were able to change one thing in today's healthcare system, I would focus primarily on the financial aspect of today's system. I would make it more like a business that encourages a competitive environment among companies, which would in turn drive the cost of things down. For example, if something breaks on your car and you need a mechanic, you have the option of knowing the price of the part beforehand, as well as the cost of labor and service. You are also given the opportunity to shop around and choose what works best for you based on the price and skill level of your mechanic. I would give patients the same opportunity by giving each patient an itemized list so they can see what they are agreeing to prior to receiving the treatment or procedure. They would also be able to shop around for different physicians as well as facilities that best fit their financial needs and as well as desired skill levels. Legally, this would decrease lawsuits later in the treatment because patients have a legal document giving consent to treat, as well as a document saying they are aware of the costs and services based on their needs and desires. Patients are aware from the beginning what the costs they may be asked to pay should insurance not cover it. This way, the government will not be held accountable and the facility providing the service will not be forced to pay the debt. I think ethically, patients should have the right to see exactly what they are paying for before they receive the treatment or surgery. The nursing role, although it is very similar to what it is now, will be very education driven. And there will be a huge need to involve patients in their care. I feel patients will be more satisfied because they are in direct control of more aspects of their care. Patient outcomes will also improve. Most patients state the most stressful part of a hospital stay is deciding on how they are going to pay for their procedures and care. With this new implementation, patients will be aware of the costs through an itemized list, saying what they will be expected to pay upon discharge. It is a known fact that patients who enter the operating room with a positive attitude have better outcomes, and patients who remain less stressed throughout their stay have a decreased risk of complications and likelihood of readmission after being discharged from the hospital. Reimbursement would be assessed by the nurses primarily because they are in charge of scanning the items as the patient needs them and making sure that they are being charged appropriately for certain items. Certain items could also be included in the cost of a basic hospital stay, like the cost of the stay, linen, and 3 meals a day. But under this idea, if the patient is NPO or cannot eat a meal for whatever reason, they will be refunded the price of that meal. Patients should not be forced to pay for items or treatments that they are not receiving. The nursing care delivery would be a mix between care manager and interprofessional practice model. The nurses would still be directly managing the patient care as case managers, but the patient would be deciding on the care. Interprofessional practice comes into play when multiple professionals are working together to care for a patient, so they are all responsible for educating the patient appropriately and describing the cost of their care, as well as offering alternatives when possible. To be ready by 2020, education would continue to include their diagnosis, signs and symptoms, and treatment options, but also incorporating the cost of anything that would be associated, which will be individualized for each patient. A tool similar to the one used at Dartmouth Hitchcock Medical Center in Lebanon, New Hampshire, would be implemented in order to increase the patient's ability to make decisions on their own. This tool would use technology in order to increase the decision making in the healthcare field. Patients would be more involved in their care and understand what's going on. Using this tool, we can also evaluate the effectiveness of it. It will ask patients to come back after their care has been initiated to assess whether their outcome was what they wanted, or if there would be any changes to make. As healthcare providers, we could use this feedback to assess for ways and or to improve the decision-making tool itself in order to increase the outcomes in the future. So overall, I think by decreasing the healthcare, I think decreasing healthcare costs will be a combination of allowing patients to see the individualized list of expected costs and treatments of procedures, then signing an agreement prior to the initiation of care as well as developing a decision-making tool that allows patients to see all of their treatment options as well as the costs associated with them before making decisions. Hopefully, another benefit to this would be to decrease the national healthcare costs because people will realize it is cheaper to seek treatment to prevent a disease than it is to treat or an illness than it is to treat a chronic or emergent problem.